Okay, so chapter 6, the human body. All right, so in here we're going to be talking about anatomy and physiology. So understanding anatomy and physiology is going to help you in the field kind of understand what parts of the body are being affected and the best way you can treat it. All right. We also need to understand that lifespan development is going to be different. Okay, there's going to be different stages in life where you develop different things, and at some point where things start to deteriorate, such as vision and hearing. All right. So the introduction, you must understand the basic structure and functions of the human body. So, your skeleton, your cardiovascular system, muscular system, yeah, the basic functions of the body. What each thing does. So, the heart pumps the blood. The brain tells the body what to do. The lungs are for breathing in and out. Okay. Like I said, understanding this helps you to understand and better treat your patients. Okay. So just a little bit of information here, topographic anatomy. So this is what we're going to use when we're describing injuries to a patient. So we're going to say anterior, meaning the front of the chest, posterior, back, proximal and distal. Proximal is going to be closer to the body, distal is going to be further away. So my elbow is proximal to my wrist. My wrist is distal from my body. Okay. Medial or midline is going to be an imaginary line that splits the body in two from left to right. And then that left and right side we're going to refer to as lateral. Okay. The other thing you can see here is we're also talking about superior and inferior. So superior meaning nearer the head, and inferior meaning away from or towards the feet. So the best way to remember that is thinking of superiors as people being above you. All right. So the standard anatomic position, as you saw in the last photo, is a person standing facing you with their arms out by their sides and their thumbs pointing upward. Okay. The palms are going to be open, the hands are going to be open. You're going to be able to see everything. All right. And then remember, the anterior is the front surface of the body and the posterior is the back surface of the body. And remember, we talked about the midline being an imaginary line that splits the body in left and right. All right. Just another little quick recap, okay? The medial or midline of the body, lateral being away from the midline, so that's going to be your left and right sides. Proximal is going to be closer, and distal is going to be distant. Okay. If you notice, those two words kind of look the same. They should be easy to remember. All right, and then superior and inferior, closer to the head and then closer to the feet. All right. So the respiratory system. This consists of all the structures that contribute to normal breathing. This is what allows oxygen and carbon dioxide to be exchanged. Okay. When you breathe in oxygen, all right, a bunch of little things happen in the lungs, and when you breathe out, you're actually exhaling carbon dioxide, all that bad stuff that your body doesn't need. All right. Just a quick diagram real fast here. You can see the upper airway and the lower airway. I know it's not labeled, but you see the nose and the mouth, and then behind that you have the nasopharynx and the oropharynx, and that already goes down into the trachea. All right. And then from there it breaks off into the bronchi, the bronchioles, the main bronchus, and all of those are going to be encapsulated in the lung. Okay. And that diaphragm, that's going to be the muscle that helps you breathe. All right. So here again, we have the nose and nasopharynx, the mouth or the oropharynx, your throat, your larynx, your trachea, and then the passages within the lungs. Okay, your trachea is going to be your windpipe. All right, and the larynx is going to be your voice box. All right, that's where your vocal cords are. All right. Just another quick little diagram. It kind of tells you where every little thing is. So that epiglottis, okay, that's going to be a little flap that keeps food and stuff from going in the trachea. Okay, it's actually going to go down the esophagus. Okay, so the esophagus is going to go into your abdomen, and your trachea is going to go into your lungs. Mhm. So we talked about respiration being that exchange of oxygen and carbon dioxide, and that actually happens inside the lungs in these little air sacs called alveoli. Okay, that's what these little ball-looking things that are actually inside your lungs are. Right, and their job is simply just to exchange the carbon dioxide out of the blood and replace it with oxygen so that it can get sent to the body. So here we talked about the diaphragm. As you can see, air is inhaled when the diaphragm of the chest contracts, and then when it relaxes, air is exhaled and it's pushed out. So as you can see in the top picture here, when they contract that muscle, it actually drops down and opens up the lungs for air to come in. And as it relaxes, all the air is pushed out. Right? So here we're going to jump into the circulatory system. So this is the heart, the blood vessels, the way the blood flows through the body. All right, so the flow of blood. Blood picks up oxygen in the lungs and goes to the heart. From there, it's pumped to the rest of the body. Right? As it's pumped through the body, the cells of the body is absorbing all that oxygen, and then as it's absorbing the oxygen, it's getting rid of all the waste products, and the blood's going to carry the waste through the kidneys and lungs where it's going to get filtered out. Okay, in the lungs, it's going to exchange that waste, that carbon dioxide, for more oxygen. If it goes to the kidneys, as you're going to learn later in this chapter, it's actually going to get transformed and turned into urine. Right. So the heart, it consists of four chambers. You've got two atriums and two ventricles. Right. So from here, blood comes in the right atrium and it drops down the right ventricle. From there, it goes to the lungs. Right. From the lungs, it comes back into the left atrium, down into the left ventricle, and then from the left ventricle, it gets pumped through the rest of the body. Okay. And all of this happens pretty fast, and all of this blood has to go through valves, and these valves are one way. So blood can't backflow, right? It's only going to fill up, right? That's going to be your tricuspid and your bicuspid valves. Right? Here's the diagram, and this basically just helps explain everything that I said. So blood comes in from the body into the right atrium, and then from there it goes into the right ventricle from the tricuspid valve. All right. From the right ventricle, it gets sent to the lungs. All right. That's where that exchange happens, that carbon dioxide and oxygen. All right. It comes back from the lungs into the left ventricle. All right. From the bicuspid valve. And then from the left ventricle, it's pumped through the rest of the body. So your left ventricle is actually going to be the strongest part of your heart because it has to pump with enough force to get that blood through the entire body. All right. So the arteries in your body, they carry blood away from the heart. The best way to remember that is they both start with A. Okay. So they're going to have the thicker walls. All right. So three of your major arteries is going to be your neck, your groin, your wrist. All right. And they're going to be called your carotid, your femoral, or your radial artery. All right. Yes, your brachial artery is a major artery. But in a sense of these three, these are like the three main ones that are really focused on in a lot of medical cases. Okay. So your carotid artery is going to be the one that goes up to the brain, right? Your groin or your femoral artery is going to control everything from your lower half down. Okay. And then your radial artery, that's typically going to be the one that can sustain a lot of damage. A lot of your trauma cases or open wrist fractures, people who commit suicide or want to commit suicide that typically cut their wrists, that's the artery they're going for. Okay. And then here you can just kind of see the differences and kind of where they're actually located at or where they start. For the femoral artery, it's going to start right there in the groin, right? And then carotid artery, that's going to be the artery you use when you're checking a pulse. Okay. And then as you can see, if you actually look at where the heart is, you can kind of see the two arteries that come up and kind of curve right back down. Those are going to be your brachial arteries. And then as you see, they just kind of branch off real fast. All right. So the capillaries are going to be the smallest vessels. They're going to be your very small blood vessels, and a lot of those are going to be found in the skin. So if you get a skin tear, that's what can cause that to bleed a lot. All right. Your veins are going to be very thin as well, and that's what's going to help carry blood back to the heart. That's why a lot of times, a lot of your a lot of your medicine is pumped in through the veins because it's able to go to the heart, and then from the heart, it's able to get sent to the rest of the body. Okay. And then blood has several components with it. It's got your plasma, which they're using right now for COVID-19 studies. Okay. They're trying to find ways that plasma can help create new vaccines. Red blood cells, which is the exchange, it's going to carry all of those gases. Right? White blood cells, that's going to be used to fight your infections. And then your platelets are going to be used for your blood clotting. All right, so from there we have the skeletal system. All right, so the skeletal system consists of bones and connective tissues that protect and support the framework for the body. All right, so that's going to be it's going to be what helps the body stand, what helps the body walk. It's going to protect a lot of your major organs. All right, so it's going to include your ribs, right, your pelvic, your femur, your humerus head. All right, all of that's going to be part of the skeletal system. And this is also where you're going to see the creation of red blood cells. So here's just a quick diagram of the skeleton, and as you can see, it's going to break down a lot of these bones for you. So obviously you have the skull, and then from that, it drops down into what's called the shoulder girdle, and that's going to consist of your clavicle and your scapula, and it's also going to consist of the humerus head that sits right there in the shoulder. All right, your clavicle is also going to be known as your collarbone. Okay, and then it's going to drop down into some more stuff. So your sternum, your thorax, which is your ribs. Like we said, the humerus is going to be your arm right there at your brachial. And then that's going to consist of your upper extremities, and that's going to be your humerus head or your humerus bone, your ulna, and your radius. And those are going to be the arms that make up the bones that make up your forearm. Okay. And then you have your pelvis, and then from there, it's really going to drop into the lower extremities. And that's going to be your femur, your patella, and then your tibia and fibula. Okay. So this skull, the bones of the head and the skull, there are several of them, and they're fused together, but the skull also includes the lower jawbone, or the mandible. Okay? Like I said, it consists of many bones fused together to form a hollow sphere. And basically what the sphere does is it's going to protect the brain. Okay? Because the brain is going to be the central system of the body. It's going to tell the body everything that it needs to do. So you want that protected. All right? And then the jawbone is just a movable bone that is attached to the skull. It completes the structure of the head, and then it allows us to be able to use our vocal cords and our voice box to make noise. Okay? And then from that, we have the spine. And the spine is, it is what it is. It really is the backbone of the skeletal system. Okay? This is what's going to give us our structure. Right? And it consists of 33 vertebrae. And they're stacked one on top of the other. And in between them, they're held together with muscles, tendons, discs, and ligaments. Okay. And then running through the center of the vertebrae is you're actually going to have a spinal cord. And that's going to run straight down, right, from the base of the skull, from the brain, all the way down to the end of the spine itself, near the coccyx region. Okay, and then from there, it's actually going to branch off these little sensors and sensory endings down your legs. And we'll touch base in that in here a little bit. But as you can see, the spine has 5 sections, and that's going to be the cervical towards the neck, your thoracic, which is going to be your upper back, your lumbar, your sacrum, and then your coccyx, which is going to be your tailbone. Right? And here's just that diagram that shows you the breakup of these different regions of the spine. And it tells you exactly how many vertebrae are in each one. So you know for your cervical vertebrae that you got 7 of them. And you have 12 thoracic, 5 lumbar, 5 sacral, and then 4 coccyx region vertebrae. I'm sorry. And the easiest way to remember that for me is that I have breakfast at 7, lunch at 12, dinner at 5, snack at 5, and I wake up at 4. Okay? And if you have a better way of remembering that, that's awesome. This is just what helps me know that there are 7, 12, 5, 5, and 4. Okay. Right, then from there, we're going to go into the shoulder girdle. Okay, and this is what supports the arms and the 3 bones that are attached with it, and that's the collarbone or the clavicle, and that's going to be the bone you feel right there at the base of your neck. Right, your shoulder blade, which is going to be in your back, that's going to be called your scapula. And then your upper arm bone, that's going to be your humerus. That's going to be the part on your elbow. When you hit it, it doesn't feel very good. Okay. And then the upper extremity consists of the 3 major bones. This is going to be your upper extremity. Okay. So you have that. And then you also have what is called your ulnar and your radius. And that's going to be the bones you find in your forearm. Okay. And then your wrist and hands, all those have several little connecting bones that are held together with tendons and stuff. Right. Part of the upper extremity also includes the rib cage. Okay. You got 12 sets of ribs that protect the heart, lungs, liver, and spleen. And here you can see them. Right. So along with the rib cage, you also see the sternum and the manubrium, the body of the sternum, the xiphoid process, and the sternal notch. Right? So the sternal notch is that little spot right there at the base of your neck where your clavicles come together. That little pocket right there is going to be your sternal notch. So if you take that and you follow it all the way down just to where your abdomen comes in, you're going to feel this little pressure point right here that if you push in, it kind of feels uncomfortable. All right, that's your xiphoid process. And then all of that in between is the body. Okay. So if you look at this diagram, you see a discoloration between the ribs and the sternum. So all of that light blue is going to be cartilage. All right. So if you perform compressions on somebody and that popping sound, a lot of times that popping sound's not the ribs itself as much as it is that cartilage breaking loose, because that cartilage is very fragile and it's going to break easily, but it's also going to grow back easily as well. All right. And then from there, we're going to move on to the pelvis. All right. This serves as the link between the body and the lower extremities. All right. So this is what's going to protect your reproductive organs and everything located in the lower abdominal cavity. Okay. And then you have your lower extremity that's connected by your pelvis, and that's going to be your thighs and legs. So that's going to be your tibia, your fibula, and your femur. Okay. Your femur is going to be the strongest bone in your body. Okay, it's going to take about 30, I can't remember if it's 3,500 or 35,000 pounds of pressure to break the femur. Okay, so anybody that experiences a femur break is probably going to experience a lot of severe trauma. Okay, and then the 2 legs attached to the bottom of that is going to be your tibia and fibula. All right, you're going to see a lot of those with your open tib-fib fractures, and those are going to be towards the base of the ankle. All right. And then in between the two, you have what's called your patella or your kneecap. And basically, it's just a small flat bone that protects the joint knee or the knee joint. All right. And then just like your hands and fingers, your ankles and toes also contain a large number of smaller bones. All right. So in between all these bones and all these connections, we have what's called joints. All right, it's where 2 bones come together and they're formed. And we have different kinds of joints in our bodies, okay? Most all joints are held together by tissues called tendons and ligaments, all right? And around them is thin fluid that helps keep it lubricated. The only type of joint that doesn't really have any tendons and stuff with it would be your fused joints. And you're only going to see that in your skull. There is going to be muscle around your skull, but there's not going to be as much as there would be for your clavicle and your scapula and your humerus head for your shoulder. right? There's going to be a lot more muscle because you're moving those bones a lot more than what you really think you are, right? Your hinge joint, that's going to be more of your elbow, right? That's just going to give you that 90-degree flexion up and down. You're not really going to be able to rotate it a whole lot. And then your ball and socket, that's going to be your shoulder. That's what's going to give you that full range of motion to reach behind your back, reach across your chest. Um, Really, that full circular motion that you get out of your shoulder, that's because of that ball and socket joint. Right? And then working alongside that is the muscular system. So skeletal muscles provide support and movement. Um, they also they contract and relax. So smooth muscles carry out automatic functions, and they're called involuntary muscles. All right, these are muscles that move without us having to do anything. Voluntary muscles would be me picking up a pen or throwing a football or a baseball. Okay, I'm voluntary moving my arm in that direction. An involuntary muscle, we don't have to tell our minds to do it. It does it on its own. Okay. And then, of course, cardiac muscle, much like its name, is only going to be found in the heart. All right, so your nervous system, this is what's going to control the body's functioning. Okay. Everything your body does comes through the nervous system, and it's going to consist of the brain, the spinal cord, and all these little nerve endings that go out through the body. And here you can see in the diagram, you've got the sensory and the motor areas of the brain, right? And what it is they're going to go down the spinal cord, okay? And you're going to have what's called peripheral nerves that come out. They're going to go down your arms and legs, and at the end of those is what's going to be called sensory nerve endings. And that's what's going to be in your toes and in your fingers, and that's how you're going to feel things. And then your peripheral nerves are what's going to help you determine your body itself. So if you're hot or you're cold, or if someone's touching you, or if you've touched something, all of that is felt and then sent to your brain to let you know what just happened. All right. So the brain's known as a central computer, rightfully so. It controls everything, right? From your thinking, your voluntary and involuntary actions, everything goes through the brain. Right? And then just like we talked about, the spinal cord is going to be a long tube-like structure that extends from the base of the brain through a little opening in the spinal column, and it's going to go all the way down to the base of that spine. Okay? And then from there, we have the digestive system. Right? And this breaks down food, and then anything we don't need is eliminated. So it pulls all of the nutrients, all of the vitamins out of everything we eat and drink. And then it keeps all of the good stuff, and then it gets rid of the bad stuff, typically a solid waste. Right? A lot of your major organs in the digestive system are going to be found in the abdominal cavity. All right? So your digestive tract starts with the mouth, and it continues through the throat, esophagus, small intestine, large intestine, rectum, and then the anus. Okay, and as it's going through your stomach, your small intestine, and your large intestine, it's pulling out all of those nutrients, all of those vitamins, anything good that it thinks that your body thinks it needs, it's going to pull those out. All right, everything that it doesn't need, it's going to send out. All right. Here's just a picture of it to kind of help you understand the flow of things. Okay. So like we said, begins with your mouth. Okay. So from there, it goes down your esophagus. All right. In the esophagus, it goes into your stomach. All right. Like I said, from your stomach, your small intestines, your large intestines, it's going to get filtered through, and anything that the body can use, it's going to pull out. All right. A lot of stuff that we eat, a lot of stuff that we drink, a lot of medications that we take are also filtered out in the stomach, filtered out in the liver or the kidneys, stuff like that. And that's also going to be responsible for digesting a lot of your foods too. Okay. Right. So the genitourinary system, it's responsible for the body's reproductive functions and removal of waste. Right? So it's the reproductive functions and your kidneys. Okay. So the major male reproductive organs, we know that the testes, they produce sperm and the penis delivers sperm, right? That's your reproductive system. All right. So for females, your ovaries produce the eggs and the uterus holds fertilized eggs during your pregnancy, right? If that's not the case, then the egg is released by the ovaries, travels to the uterus, and is released through the fallopian tubes, okay? The external opening of the female reproductive system, that's called the birth canal. Right? It's also called the vagina. Right? Removal of waste products begins in the kidneys. Right? This is where which filter the blood to form urine. So anything that the blood is picked up, any waste or anything bad for the body, it's going to go through the kidneys. It's going to get filtered out, and all the good blood's going to go back, and all that waste is going to get transformed into urine. Okay? From the kidneys, it's going to go through these tubes called ureters and into the bladder. And then once the bladder is full, it's going to then pass out through the body from the urethra. All right? And then from here, we have the skin. The skin is the largest living organism of the body. Okay? It's got three major functions. It's going to protect you, it's going to regulate you, and it's going to transmit information. So everything you feel on your skin gets to your brain. That's your sensory. Okay? It's going to regulate your body temperature. So if you're hot outside, your body's going to sweat. If you're cold, your body's going to shiver. Okay? And it also allows us to keep dirt and harmful stuff on the outside. So as long as we don't have any open skins or bruises or tears on our bodies, none of that bad, harmful stuff is going to be able to come in. Okay? So the two layers of skin that y'all really need to focus on will be the dermis, which is the deeper most layer part of the skin, and the epidermis. That's the outer layer. That's what's going to be on top. That's what you're going to see. All right. And so here's just a little diagram of it. So you see the sensory receptors, okay? Those are going to get sent back to the brain to tell the brain what it's feeling, okay? And as we talked about, your epidermis is going to be your layer of skin that you can see, all right? And then beneath that's going to be the dermis, okay? All right. So the skin's an effective barrier to bacteria and viruses. Like I said, as long as we don't have any open sores or cuts, not a lot of bacteria and viruses are going to get in. Our skin is going to stop that. All right, that's what it's designed to do. It can also perceive or sense things. As we just saw, it had those sensory nerve endings. So that's going to help us with touch and pain, whether we're hot or cold. And if we feel some kind of pressure, like on our skin, like something's holding us. All right. So stages of life, growth and development. Right? So your body's changing every day. Right? From the time you're born to the time you pass, your body is changing. Right? So in infants and in toddlers, their airways are very small and easily obstructed. Okay, so we have to watch for them. The other thing with toddlers is they're starting to walk. Right? Their coordination is not the best, so they're at risk for falls. And this is where you're going to see a lot of your green stick fractures. Okay. From there, you have your school-age children. Right? This is where kids typically become more active. They're outside playing more. They're riding bikes, doing gymnastics, playing football, baseball, and basketball, soccer. Right? These are going to be a lot of your athletic injuries. Okay? And then from here, we have the adolescents. These are your teenagers. These are people just starting to drive. Right? So this is where we're going to see a lot of our car wrecks, a lot of our traumas. Right? This is typically the point where people think that they're invincible. Okay? Moving on, we have early adulthood. This is where people are typically in their most healthiest state of life. Okay? They're more active, exercising regularly. Their bodies are typically at their peak. Right? And then from here, that's when things start to decline. Okay? They're not as active as they were. They start gaining weight. Okay, and then during the late adulthood, that's when things start to deteriorate. Their hearing's not as best or their sight's not as best. They can't see what they used to. Okay. So talking about vital signs, like we said, with your body and everything changing, your vital signs are going to change as well. All right. So the vital signs for medical responders or first responders, the three that y'all really have to worry about is going to be the heart rate, respiration rate, and the blood pressure. Okay, so normal vital signs change with age. And also to change depends on the person as well. So if someone's more active than someone else, their vitals are going to be different. And then here at the bottom it says your systolic blood pressure increases. So think of it as your age gets older, your systolic gets older. Okay, and here's a little table to help show that. So infants and newborns, typically their pulse rate's going to be very high. Okay, the bodies are smaller, respirations are going to be higher, and their systolic pressure is going to be lower. Okay, their heart's not having to pump as much blood, but it's going to have to pump fast because it's smaller. Right, and then as they get older, their pulse rate tends to go down some. Respirations go down. As you can see, your systolic goes up. Remember we said as you age, your systolic ages. And then typical adults, your pulse rate is going to be between 60 and 100. Your respirations, it says 12 and 20. On average, it's going to be about 16 to 18 breaths a minute. Okay, and then your systolic blood pressure for many adults is 90 to 140. And like I said, if you're very active, their resting heart rate or their pulse is going to be a lot less than 60. Some may have a 55 or 56 resting heart rate, and that's normal. Okay, but there are also some other things to consider with their vitals. If you look at the table, it says stress, pain, illness, fever. A lot of those can cause a change in blood pressure. A lot of those can cause a change in heart rate or breathing. People that get stressed often tend to have anxiety attacks, so their respiratory rate's going to go up. Okay? This is one of those where it's very situational dependent, or it's very, you have to take a very systematic approach to how you deal with certain patients. Okay? So just a quick recap of everything. So the respiratory system consists of the lungs and the airway, all right? Circulatory system consists of the heart, the blood vessels, and the blood. Think of it like a water treatment system. All right, so you have the heart, the pump, okay? It's responsible for getting water to all of its citizens, okay? The blood vessels are going to be your pipes, your huge, huge water pipes. And the blood's going to be your water, all right? You want that blood to get everywhere it needs to be, okay? And then the skeletal system consists of the bones of the body, okay? And the muscular system. You can combine the two and you can have what's called the skeletal or the muscular skeletal system. And essentially it's just one working in contraction with the other. All right. But the muscular system, like we talked about, consists of three muscles: your voluntary, involuntary, and your cardiac muscles. Okay. So your voluntary is going to be your skeletal muscles. That's going to be you moving. All right. Your smooth muscles, those are going to be involuntary. Those are going to move on its own. Okay. So where you're eating, if you swallow food, you have smooth muscles in your esophagus. It's going to help send that food down, okay? And your abdomen, all right, your stomach, your large intestines, your small intestines, all that's going to be smooth muscles, right? And then we talked about the cardiac muscle. That's only found in the heart, okay? So your nervous system, we talked about the nervous system being the central computer for the body, all right? Everything your body does goes through the brain. Right? And then the digestive system, right? That starts at the mouth and then it either ends at the anus, all right? So everything you eat, your body's going to pull all of that good stuff out and it's going to get rid of all the bad, okay? And then the genitourinary system, that's your reproductive organs. That's your kidneys, right? That's where your blood gets filtered and that's how we sustain life, right? And then your skin. Remember, your skin is the largest living organism in your body. It's designed to protect you. It's designed to regulate your body temperature, okay? It lets your brain know what's going on the outside, okay? And keep in mind, with all of these, talking about vital signs here, people that are more active are going to have lower vital or lower respiratory rates, lower heart rates because they don't need them as much because their bodies are steady going, right? But with that, you can also have these injuries to the musculoskeletal system, to um, the skin and all those other things, right? So keep in mind that not every call that you run is going to be the same call. It's very situational dependent, and it's very um, patient directed.